Good morning. Welcome to the COVID-19 weekly media briefing. I'm Carrie Schurig, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start as we always do with the numbers. As of February 1st, we've had 10,534 confirmed cases, including 44 from Sunday and 52 from Monday. We've got 21 people hospitalized in Shasta County, including 1 in the intensive care unit. Our regional ICU capacity, which is not being used as a measurement of to put us into a regional stay-at-home order, but we are still measuring that. That was listed yesterday at 24.4%. We've done a total of 141,137 tests. We have an estimated 312 active cases, and we have 10,072 people who have been released from isolation. And as of yesterday, we have had 150 people in Shasta County who have died from COVID. With us today, we have Robin Schurig. She's the director of the Public Health Branch of the Health and Human Services Agency. Dr. Karen Ramstrom is our health officer. Matt Pontus is the CEO for Shasta County. From our healthcare providers, we have Dean Germano from Shasta Community Health Center, Mark Mitchelson from Shasta Regional Medical Center, and Robert Fulden from Mercy Medical Center, Reading. Robin, would you like to get us started today?
Sure, thank you, Carrie. Good morning. I have a couple of pieces of information to share. The first I have shared yesterday at the board, and we included it in our daily update as well, but I think it bears repeating. And that is that after a surge from the holidays, both our case rate and our test positivity are coming down. Our adjusted case rate from the week of January 17th was 25 daily cases per 100,000 population, and our test positivity for that week was 4.9%. So while our case rate is still in the purple tier, both our test positivity and our equity metric are in the orange tier. And as a reminder, the equity metric is a measure of test positivity among people who live in certain areas of the county that are considered more disadvantaged based on data from the Healthy Places Index. And so because both of those measures, the test positivity and the equity metric, are 2 tiers below our case rate, excuse me, we actually could qualify to move down into the red tier in 2 weeks if those criteria continue. So if our equity metric and our test positivity remain in the orange, so that's anything below 5%, and if our case rate continues to decline from week to week for the next 2 weeks, we could qualify to move into the red. So that's great news. And as a reminder, the things that every member of the public can do to help us get there are to stay home as much as possible. And when you do go out, remember to wear your mask and keep your distance. We also recognize that this weekend is Super Bowl Sunday, so people may be planning gatherings. We would encourage you to not hold those gatherings at this time in order to help us move into that red tier. But if people are planning gatherings, if they could be kept outdoors, as small as possible, as brief as possible, maintain distancing, and definitely don't attend if you have any symptoms that could potentially be COVID. The other thing that people can do to help us move into the red is to get tested. And I've said this before, but I'll say it again, the higher our test volume is, the more our case rate can be adjusted down rather than up. What's happening right now is that our case rate is being adjusted up because our test volume is lower than the state average. So if our test volume were to be higher than the state average, as it has been at some points in the past, then our case rate would be adjusted down. So that could help us move to the red even more quickly. And then the other thing that it can help us do is that the more people who get tested on a regular basis because they're out and about interacting with people, either through their jobs or for some other reason, then the lower our test positivity is going to be. If it's only sick people who are getting tested, then that results in a higher test positivity rate. So that's another thing that people can do to help us move into the red and hopefully eventually even lower. And then the other piece of information I wanted to share is that just a reminder that all of the information that we have available to us about vaccine is on the shastaready.org website, along with the blue oval button that says, "Tell me when it's my turn." And that's where you can click and enter your information so that we will know to contact you when it's your turn to get a vaccine. If people don't have internet access, they can call us, but we highly encourage everyone who does have internet access to check that website first to see if the answer to your question is available there, so that we can keep those phone lines open for people who truly need them because they can't access the website. And that's all I have to share this morning. Thank you.
All right, Dr. Ramstrom, did you have anything you wanted to share this morning?
I do. I thought I'd give an update on COVID-19 vaccine. We're really excited. There's so much interest in our community in getting vaccinated, and share the frustration amongst all of you about understanding where and when you can get that vaccine. And we're really hampered right now. Really, it's based on vaccine supply. So I thought I would update everyone on that and our process. So to date in Shasta County, to Shasta County Public Health, we've received 14,350 doses and pretty much pushed all of that out. We push it out every week, and I'm going to explain that process in just a moment. We, on average, I'd say over the last 3 weeks, up to this week, have received on average about 2,300 doses a week. And just to provide some context, so that's 14,350 doses to the county so far. And we have, if you will recall, phase 1A is healthcare personnel, healthcare workers. We have over 14,000 healthcare workers in our county. And so that 14,000 doses doesn't go very far when we try and begin to reach older adults and people with high-risk medical conditions. And so that's really our limitation right now, is our vaccine supply. Now, that doesn't include a couple other pots of vaccine that are coming into our community. The VA, for the Veterans Clinic, they're receiving doses directly from the VA, and the Indian Health Service provides doses directly for our tribal clinics. And so that's good news. In terms of our process, we receive weekly allocation numbers from the state. We receive an email on Sunday about our second doses for the week, and we receive an email on Tuesdays for our first doses. And then when we get those, we reconcile that with what we ask of all of our vaccine providers to let us know, what do you have planned for vaccination this week and next? And then we can distribute those vaccine doses across those vaccine providers. Many of those vaccine providers have many more clinics than we can, spots than we can supply vaccine for. And so that's one of our challenges right now. I should say also that we're really fortunate that Mercy Medical Center Reading, they've been a great partner from the beginning, and they help to manage our supply, not only for our county, but for the region early on in this response, and are also taking care of a large supply of their community clinics as well. So that's good news. In terms of vaccine providers, so we do have a list of those vaccine providers on our website at shastaradio.org on the vaccine webpage. And just to let you know, so all of those providers have to be enrolled and approved by the state. And so there's a process around that. So we are it's in the works getting more providers in our community enrolled. And so if you are a healthcare provider, or you have a healthcare provider and you're wondering when they're going to get vaccine, it's a matter of getting them enrolled with the state and having enough vaccine supply to provide to them. In terms of, I let you know that when we hear from the state what our vaccine allocations are for the week. So this week we heard on Sunday that we have 1,200 doses, second doses of Moderna, and for first doses, 975 of Pfizer and 1,600 of Moderna. And just to provide context, we know that one of our vaccine providers does about that 975 a week, and another one does about 1,200 per week, and another one about 500 per week. So that supply, you can see, does not go very far, and that's not even across all of our vaccine providers. So what groups are currently being vaccinated? As you know, we've been vaccinating healthcare personnel for some time now. Also, the long-term care residents are continuing to be vaccinated by the Pharmacy Partnership Program. I'll give a little bit more information on that in a moment. We're also really focused on individuals 75 and older, and emergency service workers. We've been vaccinating them for a bit as well. We're starting to plan and would really like to move to 65 and older with high-risk medical conditions as vaccine supplies allow, but we know there's a large number of 75 and older that are not yet vaccinated, so we're really trying to focus on that population. And we're also planning for our education and childcare staff, so some processes in the works to get those folks lined up as we get vaccine over the next few weeks. And we're also looking ahead based on the state's framework at Food and Ag and trying to get some guidance from the state about what that involves. So we'll be planning for that group in the near future. So just a reminder to go to shastaradio.org on the vaccine page and look for the My Turn button to put in your information. And that's the list that we're using to schedule many of our clinics right now, especially for 75 and older age population. In terms of our mass vaccination clinics, we're continuing to work to identify locations for those throughout the community and working with our healthcare partners to figure out how do we do that jointly and develop a schedule to be doing that and ramping that up as more vaccine supply comes with time. In terms of the long-term care pharmacy partnership program I mentioned earlier, that's a federal program. And so the state takes off the top of the state's vaccine supply doses that go to that program, and they do that every few weeks. And so those weeks, oftentimes our vaccine allocation goes down. But the good thing is that program is vaccinating. All of our skilled nursing facilities have at least initiated vaccinations. Some have started second doses. And there's over 140 facilities on this list of a variety of kinds of residential facilities for our older adults and vulnerable populations. So those facilities are scheduled to get vaccinated over the next couple of months. And then I just wanted to make a note about, you see in the news about these emerging variant strains of the SARS-CoV-2 virus. And just to let you know, there's a lot of effort in the works at the state level to monitor, what strains do we have in California? They have regular surveillance that they're doing. Our public health lab provides specimens, as do other labs, to the state to do some testing to identify what variants are happening in California. They do a sampling on a regular basis. And so with the emergence, particularly of the strain that we've seen in the news that was in the UK, the B117 variant, it has a particular mutation that makes it more transmissible, more likely to infect people. And so there is concern that is going to become the dominant variant in the United States, which just makes it even more important to make sure that you're continuing with the prevention strategies that Robin spoke about shortly, just a little bit ago. We have to make sure that we're protecting ourselves even more so as that variant becomes more predominant. In addition, it really amplifies our need to get vaccine out sooner than later, and that is recognized at the national level. And so we're hopeful that additional vaccine supply will be coming, and we'll keep you updated as soon as we know more on that. And that's all I have this morning. Thanks, Carrie.
All right, thank you, Dr. Ramstrom. Do Matt or any of our healthcare providers have anything they'd like to start us with before media questions? Seeing none, we are ready for media questions.
I've got a quick question for somebody from the county. There's a report or a health person in Glenn County saying they don't think rural counties are getting a fair shake with the number of vaccines that are being sent to them. Is that the case in Shasta County? Do you feel like we're not getting our fair share?
Well, I can speak to how the state's allocating, and I think we all wish we had more. And so it is frustrating, especially for some of the smaller counties that are relying on these kind of regional distributions. So what the state has done is they've allocated that vaccine supply based on that we're vaccinating. So for example, in the very beginning, they distributed across the state based on the percentage of healthcare personnel in each of those counties. And then they've added in the older adults, for example. So we all look, I think all of us compare the county allocations every week and have questions on our mind, and can only share, what we know as far as how the state's doing that. We all wish that we had more, and we'll continue to advocate for getting more, and always look for opportunities. If there is some vaccine that somebody's not using and the state's reallocating it, we always try and take advantage of that.
A two-part question. Has anyone died directly from being vaccinated in Shasta County? And are any of the vaccines, have they been wasted at all? Have any of them thawed out and not been used?
Absolutely not. Nobody has died of COVID-19 vaccine in Shasta County or elsewhere that I'm aware of. And as far as wasted doses, we take extra steps in every clinic. It's a challenge. It's a challenge for everybody who's doing this vaccination, that we don't want to waste doses, and we know we have to use up what we've opened up for that day. And so we've developed strategies where we have a list of who we're going to call at the end of the day when we have 3 or 4 doses left in that vial. And so we all take steps to prevent wasting doses. And I'll tell you, every one of our task force calls, our vaccine providers say we have not wasted 1 dose. And so you may hear also about people, oh, you're not in the right group and you got vaccinated. So our strategy has been to try and use those end of the day doses on our priority group that we're trying to vaccinate, or even the groups that we're moving towards. We're going to be moving towards shortly. And so it's a challenge for everybody. And I am not aware of doses that have been wasted by our vaccine by our vaccine providers. But it can happen just because of what I just described. And the other challenge is, you know, we're getting more doses than expected in each vial, and sometimes it's hard to predict how much you're going to drop and plan for that clinic.
Thank
Hi,
you.
my question is regarding long-term care facilities and the people who have died at them. Marquis now has 16 deaths, according to the dashboard, and Windsor 22. And it seems like there's at least one death at every other nursing home in Shasta County. So in the last few days, there have been quite a few deaths, 5 yesterday, 3 the day before, reported. Did they happen in long-term care facilities? And how many long-term care facility deaths have happened in Shasta County total?
I don't have the total number at my fingertips right now. We definitely track that. I would say that as we saw our very high case rates in Shasta County, particularly in December and January, in November as well, that translated to additional transmission than we previously had in all of our facilities, because people who live in the community work in those facilities, and despite all the prevention measures, transmission can happen. And we're seeing now deaths across, whether in our facilities or not. I will tell you that the percentage of our deaths that are associated with people in those facilities is much smaller than you would think. And I don't have it in front of me. I don't know if you recall, Robin, it was something like, I don't know, 20% or something. So it's not what you would think. It's not the majority of our deaths, for sure.
Thank you. So just to clarify, percentage of the deaths that you're reporting, 20% of them would be people.
If you'd like, I can look it up while someone else.
I'm sorry. I just want approximately a fifth of the people who have the deaths.
I'll look it up. I'll look it up.
Thank you, Dr. Ramstrom.
Good morning. This is Anna here from Channel 12. I just kind of wanted, this one is for you, Robin. You mentioned, because the Super Bowl is coming up this week, and it looks like the county is heading in a very good direction right now, slowly kind of drifting to the red tier. Possibly people could be getting together for Super Bowl. Could we see maybe if people get together and we see that surge after, could that affect our placement heading into the red tier?
Yeah, absolutely. We've seen surges over time after certain holidays and other events where people are more likely to have gatherings, including Christmas and New Year's most recently. And so, yeah, if there were to be a lot of gatherings and a lot of COVID spread going on connected to those gatherings over the Super Bowl, then we certainly could see our case rates and our test positivity increase again, which could prevent us from moving into the red tier.
Thank you. And then, sorry, can you just clarify, it's a possibility how Shasta County could be shifting into the red in a couple of weeks. Is that what you said?
Yes, that's correct. So if our health equity metric and our test positivity remain in the orange and our case rate is declining, then even if our case rate is still in the purple, then we could move into the red tier in 2 weeks.
Thank you. And then this one is, I guess, for any of our healthcare providers, or maybe even for Dr. Ramstrom. I was seeing a couple articles the last couple of weeks about some doctors or healthcare professionals recommending double masking, especially as we're seeing more variants of the virus appear. Just kind of anyone's take on that. Do you recommend doing double masking?
I am not up on if actually NIOSH or CalOSHA recommendations have changed. I think from the beginning that's been a strategy, and also to protect respirators. But I'll also defer to our facility partners who are on to see what they're doing, if they've changed their practices.
So really what we're following with CalOSHA and the CDC is the single mask. However, we're not preventing individuals from, if they feel like they're being more protected by having a second mask on, we're not saying no to that. Sometimes it's really just personal preference and how comfortable they are and what kind of environment they are, if they're in the COVID area or if they're just taking care of regular patients. Really, you're seeing it more as a personal preference, that second mask on.
Okay, I have a
Yep.
question. Sorry, Robert, go ahead.
When we were trying to conserve, that was also a strategy when a standard surgical mask was available. It was not uncommon for folks to help in conservation of the N95s to put that over their N95 mask. But now that the supply is plentiful, we need to adhere to CDC guidelines.
Thank you.
Right, I have a question from Donnie Chamberlain from a news cafe. She is having audio difficulties. It's for you, Dr. Ramstrom. Can you tell us more about the incident in Shasta Lake City when some visitors, as you referred to them in yesterday's meeting, showed up at a vaccine center over the weekend? What strategies have you put in place to deal with any future incidents?
So we talked about this that day and then afterwards. I think that we need to have some clear signage. So when we have these types of events and we've leased facilities to make it clear on who we want to be coming into the building, who it's appropriate to have enter. We want to make sure it's a safe space for everybody, whether it's for our volunteers and healthcare workers or for the people who are coming to get vaccinated. And then, just being clear on what the parameters are so we can communicate that to people who might be there trying to express their views. And so we will, plan to share that with staff so that they're well aware as well going forward.
All right, thank you. And Jessica, in response to your question, we're going to have to check back with our epidemiologist to double check that information, but I will get it to you hopefully today.
Thank you so much.
Yes, of course. Are there any other media questions?
Oh, hi. Sorry, Anna here again. I just wanted to clarify something with you, Dr. Ramstrom. Oh my goodness, sorry. So the 14,300 doses, that's how many doses the county received in terms of both Pfizer and Moderna, correct?
Yeah, that's correct.
The 2,300 you mentioned, is that the 23 doses that have been administered of the vaccine this week?
So I was just making the point of generally how much do we get every week? And it varies every week, which makes planning difficult. But on average, over the last 3 weeks, we've received about 2,300 doses on average every week recently.
Is that for Moderna?
It's a combination of both.
Okay. And then do you know how many vaccines have been administered throughout the county?
That it's been quite a challenge to nail that down. There have been challenges with the California vaccine registry. We periodically ask all of our vaccine providers what that is. I don't have it at my fingertips so that we can kind of keep track of it and compare it what our vaccine providers are telling us versus what's in that registry, which is why we know that registry is an undercount. And so I don't have that. We're hoping to have more reliable data soon, and it's a statewide issue.
Thank you to everyone, and we'll see you again next week.